to see you. So Dr. Himanshu Mehta will be going in at this point, and after that, Damien and then Ron. So we've had a small shift because Himanshu has to, kind of take a flight immediately. So Dr. Himanshu, please go ahead and let's hear you.
Morning. Thank you so much for accommodating me. And first of all, Namrata, thank you for inviting me for this prestigious conference.
Wait, let me just see where it is.
White cataract,
yes, just
brown cataract or a black cataract always creates a lot of trouble in our life. It always gives you a few missed heartbeats, and there is never the last word said from the last few years and decades. There is as much which needs to be said.
Can you see it?
Yes. Yes, ma'am.
Full screen?
Thank you. Yes,
it's good.
Thank you.
Okay.
So after you graded and, at any given point of time, the position is a great rhexis is the one which is going to help you tremendously because the pressure is phenomenal on the capsule. It wants to bulge and get out of its shackles. The fluid so you got to grade it well, your stability, your denseness, whether it's soft, what is the status of the anterior chamber, it's a shallow AC, what is the pressure. These are very important things, plaques, because you may have a lot of things hidden behind that. So first of all, never forget, you've got to stay in the anterior capsule. It's a great support and it can change your dynamics of the whole surgery. The day Trypan Blue was introduced, earlier we used to use an endo illuminator to see the capsule. But now that you have Trypan Blue, you can always go ahead and do that. You've got to debulk the nucleus from mid-periphery. Now, this is a manual one which I'm showing. We can always do it with the femto laser too. You go ahead and put viscoelastic, but don't overfill the whole thing. Let the lower lip be pressed. And with a 26 gauge needle, you could just go inside gradually and aspirate whatever liquid cortex and or fluid that you can get. Feel free to do it as much as you want. And the moment you reduce the pressure, suddenly the capsule starts floating and you know that things are not too bad. Once you're there, and you can always go ahead, put in a viscoelastic and go ahead and do your rhexis. But a big rhexis in a brown, black or a white cataract is a boon. And that's where you have to be careful how well you go ahead with it and how you plan your rhexis at any given point of time. It's always a challenge in a shallow anterior chamber when the vitreous pressure is high. You have to use your femto machine if you have to, but look at that. Go gently, allow the lower lip to allow the viscous fluid to escape a little bit, aspirate, and you can change the direction of your rhexis at any given point of time. Change your shoulder, your palm, your wrist, and your forearm position to pull the rhexis away because this rhexis somehow behaves very, very, very differently than a regular cataract. And it has a tendency to run off toward the periphery because you look at that, I change the direction at the last minute, pulling towards the center. So you might as well do that, change your position. If you have a white cataract, you've done your femto, you have a great phenocaine, which has come out as a great pupil dilator. It helps you to dilate. And a heavy viscoelastic, dispersive kind of a viscoelastic will always let you dilate the pupil a little more and keep your chamber flattened. Also saves your endothelium because quite a few of them have a very shallow anterior chamber and you really need to protect your endothelium at all given points of time. And that's the whole beauty. A good amount of rhexis in whatever maximum exposure that you can get. And also they'll be very clear that you will have capsuloparticular regions. So you need to be doing your hydrodelineation quite well too. And the zonules are weak because these are latecomers. Again, a slow, gentle nudge, get into it, get out. If you're not confident, push in more viscoelastic, but don't go into the center. Don't go too much at the periphery. Just aspirate because despite you taking all kinds of precaution, at any given point of time, you may still land up in trouble. So be gentle, be sure of every step that you are taking. And at any given point of time, you don't have to be very fast to a point. You can change your mind. Now look at that. I haven't had enough access. So I can always use a small vanas to make a T-shaped opening into the rexis, because then I can cover the rexis from both sides. But there are times when I've got greedy in trying to make a bigger rexis and paid a price for it. You try to be as large a rexis as possible so that the nucleus remains good. You try and see that the chamber is well formed, and you can get away with it at every point of time. But you can still get into trouble. Get on with it. And this is a rexis with a femto. But look at that. Even there, you have to be careful because there are adhesions that may be there, because a white cataract is not very well recognized by the femto laser, and the rays may not go very sharply. Here is where I made a mistake. I just wanted to show that. I'm going ahead. You become a little complacent. As you can see, this is a little more pregnant kind of a nucleus, bigger one, bulging into the anterior chamber. If you want to make a bigger rexis, here, there goes, and there you go. Now, here is where I made a mistake, and before I could even correct myself, it's run off to the periphery. Well, so I have the other part of the T, which I start and complete the rexis to see that both the rexis matches. And then our dear friend Rohit Om Prakash's flap motility view, and you keep praying that you don't increase the pressure. Your fluidics have to be good. Don't raise the ball. Look at that, a double whammy for me. Here you go. I have a second runoff to the periphery from the other side, even before I have started my case or I've done any rexis. Well, here we go. So that's the trouble. With all the blessings and looking at the flap motility without too much of manipulation and with not too much of energy, you are going ahead, and without too much movement, you're trying.
I missed something.
We are trying to see that you break the nucleus into smaller pieces gently over a period of time. As you debulk, there is more place in the bag for you to go ahead and hydro dissect and chop smaller and smaller pieces and get it off as much as you can with your heart thumping, with two sides where the rexis is run off to the periphery. But if your rexis from both sides are almost complete, and if your flap is moving fairly decently, you have not exceeded your Lakshman Rekha and you have not gone to the posterior capsule. So this is how, as much as you can, debulk a good rexis, be in time, and that's how fast you can do. A femto laser definitely helps you because it's a closed chamber and you can get away with it, because the key to the whole access is a great rexis, big enough in size, and debulking the nucleus. Thank you for the time. Thank you so much, Dr.